Hi guys, now we can look at the overview of the sympathetic nervous system, which itself is a part of the autonomic nervous system. I will be using this 3D model of the spinal cord and the connections of the sympathetic nervous system to describe all the various pathways which is taken by the sympathetic neurons. As you can see here, I have got the model showing the cervical spinal cord, thoracic cord, lumbar, sacral, and the coccygeal region lower down. On one side, here is the sympathetic chain. It should be there on both sides, but I have drawn only on one side. Yeah, so just remember that the sympathetic chain is bilateral. It's on both the sides. In front of the vertebral column, which lodges the spinal cord, we have the aorta, and the aorta gives rise to some blood vessels which will reach the organs. Okay, the reason for showing this is for any autonomic nerves, okay, the sympathetic nerves to reach the organs, they will usually run along these blood vessels, okay, so that they don't have to find their own way. The blood vessels are already reaching the organs, the nerves will just run with them. In addition to that, just in one of the levels, to show as an example, I have shown the complete connections of the motor neuron, the sensory neuron, and the sympathetic neurons. Sorry, the red one. Yeah. Plus where they go and what they do. Okay. So these are the ones we are going to see in detail. Also, the model shows the complete notes of what I'm going to talk about, like what are the routes the sympathetic neurons can take, like a route 1, 2, 2 here, 3, 4, for example. Okay. But while doing the tutorial, I will turn off all these labels so that they don't come on my way and hide the things. I'll be explaining the contents one by one, and then we can add all the labels on that. To understand the sympathetic nervous system, firstly, let's recap the peripheral part of the somatic nervous system. That's nothing but the motor and the sensory components of a peripheral nerve. Look at this cross section of the spinal cord. Here is the posterior aspect, and here is the anterior aspect. You can see the posterior or the dorsal horn or the spinal cord gray matter. Here is the anterior or the ventral horn of the gray matter. Connected to the anterior horn is the anterior root through which the motor nerves come outside the spinal cord. Connected to the posterior side is the posterior root, which in turn forms the sensory component of the spinal nerve. You can also see the dorsal root ganglion, which contains the cell body for the sensory neurons of this region. They both join together, means the sensory and the motor join together to form a common mixed peripheral nerve. Finally, depending on where the nerve goes, you can either get a sensory branch which goes to the skin or a motor branch which goes to the muscle. Most of the times we get both the branches from a single peripheral nerve. This somatic nervous system, or the peripheral part of the somatic nervous system, helps us to interact with the external environment. Like you can touch something, feel something, and you can move your hands to manipulate that structure. For example, if you want to grab a coffee cup, you extend your arm, touch the coffee cup, and you might feel that it's either hot or cold. Depending on that, you decide whether you take the cup or leave the cup there. Now, why do I talk about the peripheral nervous system? If you understand this pathway clearly, then it is very easy to superimpose the sympathetic and the parasympathetic nervous system details on this image. The gray matter of the spinal cord is filled with neurons. However, we do not have space within the central nervous system, be it brain or spinal cord, there is not enough space to accommodate all the neurons or all the nuclei of the nerve cells. That is the reason, see here, the dorsal root ganglion is placed outside the spinal cord so that it can take up a bigger space without compromising the spinal cord. Similarly, we cannot put all the motor neurons in the anterior horn region. So when it comes to the sympathetic nervous system, those neurons are placed slightly away from that but still within the spinal cord. They take up a new position, that's this region called the lateral horn of the spinal cord. Yeah, here you go. I have added the sympathetic part into the scene. You can see that the lateral horn has got new set of neurons. These are the preganglionic sympathetic neurons. And we see that the neurons come outside the spinal cord running with the usual motor neurons because that's the nature. These both are motor neurons, so they tend to run together with each other. It does not go through the opposite side. Here is a sympathetic neuron, the nerve fiber coming from the sympathetic. It will take the same route as a normal motor nerve, and then as you can see here, it joins the usual peripheral nerve. But from here, of course, he needs to go to the skin or the muscle or wherever he wants to do, but he does not go directly to that structure. Instead, the sympathetic neuron comes outside the nerve and goes to this structure called the sympathetic ganglion. From there, a new set of neuron starts, and that neuron re-enters the spinal nerve, and that is the one which is going to the target organ like the sweat gland or blood vessels, for example. Okay, I repeat, just like a normal motor nerve which comes out, goes and forms the spinal nerve and goes to the effector organ, the sympathetic neuron does not take a direct pathway. He of course comes in the mainstream, but halfway through he has to come out of the peripheral nerve, goes to the sympathetic ganglia here, which is highlighted, and stops there. From the ganglia, a new set of neurons starts, which will then continue the journey so that he can go to the target organ. Now just we can understand why this unnecessary extra route is taken. The reason is very simple. As I told you, we do not have enough space for all the neurons within the spinal cord. So we have got additional neurons outside. They are arranged in the form of these ganglia. These are called sympathetic ganglia. And what's happening here? Imagine there are a few neurons coming from the spinal cord. They have to supply all the target organs in the body. Say for example, all the sweat glands, blood vessels of the muscle, blood vessel of the skin, etc. There is no enough nerve fibers coming from the spinal cord. So this neuron goes into the sympathetic ganglia. It synapses and functionally multiplies there, which means one neuron will potentially join with 15 to 20 neurons within the ganglia. And see, now the size of the army has become bigger. So whatever came in, it's going to multiply into 50 to 20 times so that they come outside and they are now able to supply a vast majority of target organs. So here we can see that within the sympathetic ganglia, the multiplication is happening. More and more neurons connections are added. We do not have that system sitting inside the spinal cord. That's the reason it's happening outside, and that is the reason your neuron is coming out, going to the sympathetic ganglia, then re-entering the main nerve so that it can go outside. So now we have seen two additional structures. I will repeat that. The nerve fiber, the sympathetic nerve fiber, which comes from the spinal cord and goes to the ganglion, is called a preganglionic neuron because it's before the ganglion, whereas the nerve fiber that comes from the ganglion going outside is called a postganglionic neuron. So now we have introduced two new terms, pre and postganglionic neurons. Fine. The other set of words are, see this connection which is coming from the nerve to the ganglion. This connection is called a white ramus communicans, which means a white color communicating branch. That's all. Okay, but usually the anatomical words are described in Latin or Greek, so they are not uh, very easy to understand. Instead of simply calling that as a communicating branch, in textbooks we usually tell that as the ramus communicans. Similarly, on the other side, a similar nerve fiber which connects the ganglion back to the nerve is called the gray colored communicating branch or gray ramus communicans. Now, why is this white and why is this gray? That's a simple reason. Most of the nerves, the peripheral nerves in the body, of course, all the nerves are myelinated. There might be differences between the individual neurons running inside. They might be myelinated or non myelinated, but the nerves as such are myelinated. This one is actually a branch of the nerve coming to the ganglion. So he is also myelinated. Anything myelinated is white in color. So we call this a white ramus communicans. Myelinated means it's usually a thick nerve fiber because it is wrapped by several layers of myelin. Whereas the postganglionic neurons, as I said, for each preganglionic neuron, we get up to 15 to 20 postganglionic neurons, which means there are many neurons coming outside and we don't have space to accommodate these so many neurons. So what is the solution? Just to lose some weight. So all these neurons lose their myelin sheath so that now they are able to reduce their size themselves and they can all fit back into the same nerve. That is the reason why they are not myelinated, and because they are not myelinated, they are gray in color. So the name of this connection is called a gray ramus communicans. Okay, so in addition to seeing the entire sympathetic nerve fiber which goes and supplies the sweat glands or the muscles of the skin or blood vessels anywhere, we also saw what is a preganglionic and what is a postganglionic neuron, and we saw what is a white ramus communicans, or this red color, what is the white ramus communicans and what is a gray ramus communicans. Now all this time we have seen only this part of like this level of section. This is taken from a thoracic segment. As you can see, if we have the lateral horn, that's going to be the thoracic segment of the spinal cord. But the sweat glands and the blood vessels and the skin, etc., are present throughout the body. They are also present in the cervical region, they are also present in the lumbar region, or coccygeal region, or sacral region. How is this sympathetic connection from the thoracic region going to reach the different parts of the body? Okay, the different levels of the spinal cord. That's happening through a connection called the sympathetic chain. Okay, at any given level you see a single ganglion, but overall there is a big chain. Now let's see that one by one. I will add all the layers of the spinal cord, right? Yeah, yes, this is how the entire spinal cord looks like. Here is the cervical segment, thoracic segment, the lumbar, and the sacral. Now remember, the sympathetic output comes only from the thoracic and the upper lumbar region, maybe till L2 or maybe L3. The reason for this is if you go to the cervical segment of the spinal cord, it already gives rise to cervical plexus and brachial plexus. So there is a big contribution coming from there. If we come to the lower lumbar and the sacral regions, we have the so-called lumbar and sacral plexuses coming out. So which means they are already packed with lots of neurons and it has its own function to do in the cervical and in the lower regions. So the only leftover bit is the thoracic and maybe the upper lumbar regions. So that is made use for the sympathetic supply. So that's the reason why you see the sympathetic outflow coming only from the thoracic and the upper lumbar regions. And we already saw one of the routes taken by the sympathetic nerves. So that usual route that we saw earlier within the same segment, coming to the ganglion and going back and going to the same level. Now my question was, how is the sympathetic flow from the thoracic region going to the upper levels or lower levels? That is through this ladder. Okay, so this ladder is called the sympathetic chain, which is present on both sides of the vertebral column. That's why these ganglia are also called paravertebral ganglia. That means on both sides of the vertebral column. Now you are seeing the image only on one side. That's because I have drawn only on one side, but it's actually present on the other side also. So the chain on both sides, starting from the neck, finally coming down and joining in the center like a big medallion or a dollar, and that is called a ganglion impar. Okay, the last single ganglion at the coccygeal region is called ganglion impar, which means unpaired ganglion. As I said, every tough word in anatomy has an easy English meaning. It's good to know that meaning so that you can remember some of these words. And then, sorry, I'm trying to find out the other roots. Okay, so this is the second root. Maybe it's not clear, I'll highlight it. You can see that again coming from the thoracic region, the preganglionic neuron, sympathetic, it comes to the ganglion. From there, it runs upwards, reaches the further ganglion, and from there, they make a synapse, come outside, and then they can supply the sweat gland or the blood vessels in the same level. Okay, so this is how, if you need sympathetic supply for your head and the neck, for your eyes for example, the sympathetic flow will still start at T1 level, the first thoracic. It will come out through the T1 nerve and then it will run upwards all the way till your head, neck or eye, wherever it is, or even the blood vessels of the brain. Then he will come outside to supply the target organs. That's the reason if there is injury to the T1 segment of the spinal nerve, there is a possibility that you get a sympathetic interruption throughout your head and the neck. The classic example of this is called a Horner's syndrome. Horner's, Horner''. So this is one of the routes where the sympathetic nerves can take. The other route is the same description but on the opposite side. What if we need sympathetic supply to the genital organs or the urinary bladder? The innervation will still come from anywhere in the thoracic and the lumbar, not necessarily from the top. From anywhere it can come, but it will run through the chain to reach the lower part of the body, and from there it can come outside. See, it comes down through the chain, it reaches a ganglion at a lower end, he makes a synapse there, From there, the postganglionic neuron comes out so that he can supply anything in that region. Okay, so that can be a bladder or the testis or penis, for example. So this is kind of the third route taken by the sympathetic nervous system. The fourth route is much more important. Again, the preganglionic neurons will start either from the thoracic or the lumbar level, depending on which organs we are talking about. If you are talking about the heart, then the innervation will come from the thoracic levels, the red one, from the thoracic levels. The connection will run down any of these. Okay, let's have this one. The connection will run down. It will synapse in one of the or two of the ganglia. From there, postganglionic neurons come outside and then they can reach the heart. Okay. Similarly, if you need sympathetic innervation to the digestive system, for example, the same route, nerves are coming down, they come outside to reach the digestive system organs, but there is an additional ganglion here on the way. Okay, they do not synapse in the sympathetic chain, but they come out to synapse in an additional ganglia. These ganglia are called prevertebral ganglia because, as you can see there, they are in the midline, they are right in front of your vertebral column. Okay, the reason is again the same. We do not have space within the spinal cord or in the sympathetic ganglia to accommodate more neurons, so there is an additional set of ganglion outside. These prevertebral ganglia are going to supply most of the digestive organs or most of the abdominal viscera. The classic examples are your celiac ganglion, superior mesenteric ganglion, or inferior mesenteric ganglion, for example. That's the route coming down which can supply your thoracic and abdominal viscera. And these nerves, which are connecting your sympathetic ganglia to the organs, are called splanchnic nerves. Splanchnic means, it simply means organs, visceral organs. So anything going to the organs are called splanchnic nerves. And depending on what they carry and how big they are, small they are, and where they go, we call them greater splanchnic nerves or lesser splanchnic nerves, which are more details to be studied in the other chapters. But for now, remember the connection from these sympathetic ganglia to the organs are called the splanchnic nerves. The last and the easiest route is this one, just the last line. You can see that starting from the lumbar region again, the connection comes down through the sympathetic ganglia and then it directly goes and reaches the suprarenal gland. Okay, the medulla of the suprarenal gland. So this one, this nerve is actually a preganglionic neuron coming all the way from the spinal cord without any stop or synapse. It directly reaches the suprarenal gland. There is no postganglionic neuron at all. This is the only exception in the body. In the abdomen, suprarenal gland, it directly receives preganglionic sympathetic neuron. There is no postganglionic because the suprarenal medulla itself acts as the postganglionic neurons, thereby secreting adrenaline and the noradrenaline hormones. In summary, the spinal cord has got a cervical, thoracic, lumbar, sacral, and the coccygeal segments. The sympathetic outflow comes only from thoracic and the upper lumbar levels. The sympathetic chain, which connects all the sympathetic fibers, extends from the cervical all the way through the coccygeal region, stopping at the ganglion impar. The origin of the sympathetic nerves are only thoracic and lumbar. So when they have to reach the other levels of the body, they will have to enter the ladder which is called the sympathetic chain. They will have to either go upwards or downwards within the chain before they go and supply any of the regions. In detail, in the thoracic and the upper lumbar cord, we have got the so-called lateral horn of the gray matter of the spinal cord. That is the origin of preganglionic sympathetic neurons. The postganglionic sympathetic neurons come from the sympathetic chain. The possible routes that can be taken by the sympathetic neurons: route 1, they supply the same level. So preganglionic goes to the ganglion, postganglionic goes to the effector organ. They are connected to the ganglion by the white ramus communicants and the gray ramus communicants. Route 2, if they want to travel higher up, the preganglionic neuron will come to the ganglia. It will run up the ganglia, and where he wants to go, just before that, he will synapse and the postganglionic neuron will come outside. The same story lower down. If he wants to go down, again it comes from the thoracolumbar outflow. It runs down the chain, and before he comes out to supply the effector organ, he will synapse in that particular ganglia. The fourth route is the medial route to supply the visceral organs from the thoracic or the lumbar levels, depending on which organ it's going to supply. The outflow comes out, runs in the chain, it comes outside, but synapse in a new ganglion called the prevertebral ganglion. For example, I said celiac, superior mesentery, inferior mesentery, etc. From there, the postganglionic fibers will come, this yellow one. They will run with the blood vessels before supplying the particular organ. The last route is the easiest one, because the preganglionic neuron comes all the way from the top and terminate in the suprarenal medulla. Thank you.